Environmental Health, Dekalb County Edition. My name is Georbie Cheathem. This is for my PH 3030 class, Environmental Health, and this is due April 27th, 2020. On this first slide, I show imagery to Dekalb County alone in relation to its surrounding counties, which is Fulton, Gwinnett, Rockdale, Henry, and Clayton. Dekalb is among one of the Atlanta counties listed, and Dekalb County's race construct is mostly Black and determinant of white and Hispanic. Health disparities. First, I would like to define health disparity. A health disparity refers to a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. Dekalb is the fourth most populated county in Georgia, based on its demographics listed from all the sites I viewed, more than one. 53% of the county is Black or African American, 29.1% is white, and 8.6% is Hispanic or Latino. 90.2% are considered U.S. citizens. I do believe this one is of the 2007 or 2010. Health inequities. Health inequities, when everyone doesn't have the same opportunity to attain the highest level of health. Dekalb County, Georgia, based on, I believe this is from ARC, its poverty rate is not high but livable, I believe. The median household income is $61,827, and for the state of Georgia it is $56,183. The age group that is most living in poverty is the age groups that I'm believing is 5 years all the way up to 18 to 24 years. That's the highest level. The population of my area. So my area of Dekalb consists of Lithonia and I believe Stone Mountain area. So when I snipped my area alone to determine its population, our total is 16,938, with 4% being white, 92% being Black, and 1% being some other race, and 1% being two or more other races. My concern when it comes to my population in my area is exposure to fumes, noise, and air pollution, because the area I live in have many warehouses. The exposure is to those who live around warehouses and factories, as well as those that live next to trains and tracks, because those areas are heavily noisy. They emit fumes, and they're fully operational, so it don't matter the time of day. A train could come in at night because it's scheduled at night. A factory open early in the morning. The fumes emit into the air and stand in the air, regardless of the weather. What's happening? So my issues are: one, the concentration and proximity of diesel trucks as they flow in and out of the city that I live in, as well as the surrounding areas, as because warehouses are heavily populated along Lithonia Industrial, which is only a good 3-4 minutes from my house. The warehousing facilities that service them threatens the health of people living and working near busy roads and logistics, because what they emit into the air could cause us to contract cardiovascular diseases, asthma, etc. The trucks and trains that carry freight to be warehoused, those trucks and trains can cause a hazard, one, on the traffic that goes around our houses, because they can block the traffic, as well as stop traffic completely. I've had a situation where I needed to get to my house, but the train was passing, so I couldn't even cross the track to get to my house at all, so I had to wait. And this train was a slow train, so it lasted a good 20 minutes until the train fully passed by. Trucks idling engines at or near warehouse sites that pollute by emitting small toxic particles. Those are PMs, which is particulate matter, and they emit it into the atmosphere just as if it were on a highway, a roadway, and because it's so close to housing and neighborhoods, it could be maybe more dangerous in my eyes compared to everyone. But understand, this is my opinion. It may not be, but in my opinion, I don't see it as safe as someone that lives within the community. My main concerns in relation to health issues are 1, our air quality, 2, our living quality, which also can stand for our quality of life, and 3, over-industrialization. ARC data charts have concurred, ARC stands for Atlanta Regional Commission, that DeKalb County alone, their leading causes of deaths in concurrence are cancer and major cardiovascular diseases. My concern is because of the close proximity to these warehouses. Are we being transmission these toxic air which can cause us? Because cancer and cardiovascular disease can go hand in hand with air pollution. And asthma on the chart is seen to be high as well. If we can look, asthma is at the top. So, oops. Well, I accidentally did that. I don't feel like going back. I'm sorry, professor. But here's my next slide. The dangers of living near a warehouse. My concern is dangers of living near a warehouse is because they can produce dangerous gases into the air, and then it can lower our quality of life because the gases could affect us to where we're either the smell could be disgusting. It could actually affect folks who live with cancer within my community. It can affect folks that have asthma because my brother is highly susceptible to certain air quality. So if you have asthma, it could cause you to have an attack of somewhat. So I would hope it doesn't affect people. And that's what I can see as a health inequality, because those who live around warehouses are kind of like working class. Now, after doing an expanse of air quality research, I got my information from airnow.gov. As you can see, Georgia, in the area that I live in, which is the zip code of 30058, we are considered good air quality, and good means the value of index is 0 to 50 and air quality is satisfactory and air pollution poses little to no risk. But I have a little concern because you see how close it is to the yellow, which means moderate, which is 51 to 100. Air quality acceptable. However, there may be a risk for some people, particularly those sensitive to air pollution, which is who I introduced earlier. Those with cardiovascular disease, those with cancer, those with asthma, they're more prone to either die as a cause of it or receive episodes such as, say, a coughing episode. We need to see a doctor more often. So that is a major concern for me, how close we are. Even though we are in good standing, the fact that we're so close to not being is my major concern for DeKalb. Now, in relation to DeKalb, I do applaud us because we are in a major improvement, because a news article I read earlier with the caption being DeKalb County gets an F for air quality report. and it's underscore with Dekalb has some of the highest levels of smog and soot in Georgia according to the American Lung Association. This was posted April 20th of 2018, which was 2 years ago. So this is a major improvement considering that in 2018 we had high levels of soot and smog, and that is very bad for those that are asthmatic, so a major improvement. So as I listed my research, I seen that we are improving, that it was way worse years back because we emitted more gas. For example, I think it was like a year ago in Covington, there's a warehouse that they believe is emitting benzene into the air, which is very, very dangerous gas. I don't know if they've improved it, but as activists want to consider air quality, like WHO, OSHA, all the major working activists, as well as those that were created by the government to make sure that air quality was A1, because, you know, we have amendments in laws and policies to follow. They have made sure that those are followed. The action being taken. So as I did extensive research and I did like deep dive into my topic, I did see that DeKalb County formulated a comprehensive plan to improve the quality of life by 2035. This plan was drafted in 2017 and stated the following: better use of our land. So instead of like populating everything, which is what goes into over-industrialization, you keep building buildings next to each other, like the amount and limits that we could have when it comes to quality of air and quality of life becomes more situational. Transportation methods are being improved because some people need to be able to go to work, but they need to make it safe for the economy as well as the environment. So they probably are working on better MARTA methods, better bus stops, how not to emit so much toxins into the air, creating more green spaces. That is very important. I think by green spaces, as I read, meant like shrubbery, trees, because, you know, America is going through deforestation just because of industrialization. They're tearing down all the trees and building so much land. Improve recreation, housing, and economic development, bettering DeKalb's infrastructure, natural resources, and environmentally sensitive areas, and creating more community facilities and services. Now, Census 2020. That brings me there because in the comprehensive plan, which raises my question because it said that the race distribution of DeKalb County based on the census taking place now is project a few more Asians and whites in comparison to a decade ago. One, no offense to anybody, but that sounded a little bit more racially charged, no offense, but that could be just how I took it. But what I'm seeing, but it may not make effect, is like a lot of my friends are getting pregnant, so that could really change to where more blacks and Asians instead of whites are going to be populated. So I'm very interested to see how the census 2020 turns out because, you know, coronavirus, COVID-19 has affected it a little bit because folks are dying as well as a lot of people have not been accounted for within the census. But these are what I believe. So what I believe is that the communities that populate areas that surround warehouses are those of middle class and lower class working communities, which is highly true. Like, you don't really see the rich, like a mansion next to a warehouse. You see a community of small little houses that highest is like 4 bedrooms. They're like low quality, like maybe $200,000 houses that I've seen. Like even near the train tracks, they will have them near neighborhoods, which I mean, it's very great for economy, but I don't know if that's great for community. You see that these same communities are less likely to receive the same care as those who live in North Georgia areas. The reason being that I'm saying that is because, yes, we do have DeKalb Medical, but we don't have like researchers that Grady and Emory hold. A lot of health disparities can include a mass range of ages, genders, and ethnicities in my area, so I can give you that much. Like, it's a very big range, so I can't say it's racially charged, so there isn't no inequality when it comes to race. even though blacks are more predominant within DeKalb County, that doesn't make it to where we're less likely. An inequity can also be the fact that major hospitals, like I have stated before, Grady and Emory, or even the Children's Hospital are miles away. For example, if I had GPS Emory from my current location, which I'm doing on my phone to the side right now, it is located in Druid Hills, and that's 30 minutes away from my house, not including traffic. Okay, let's see. Let's do Children's Hospital. Oh, Children's Healthcare of Atlanta. My bad. That is also 30 minutes from my house. Why are major hospitals so far away instead of being in close proximity? Like if you were to live in the city, which I believe is more damaging. My community is mostly black / African American, and they hold the highest rate of cardiovascular disease. So I do believe that makes the difference. So you would think that they will make it more separated because we are predominantly black in this area, but instead you see that they built warehouses, which I believe is unfair to those that work because we don't have a choice where we live in most cases. It's more situational based. So this could have been the best you could find or the best you could be approved for. So that's a concern. I would like to have equal living opportunities. As for example, Section 8 is only so many areas. It's a piece of Section 8 in DeKalb County is a couple streets down near my middle school. Ways to reduce exposure when it comes to air pollution. I can't say anything for the noise, unfortunately, but we can try. And the fumes is one, the time of day does matter when you leave your house. So when it comes to leaving your house, please look at the time of day. Also, the time of day can also help you to avoid the sound of trains. If they come in the morning, you could be not in the house in the morning, I believe. Also, the area you travel. So on your GPS, you can see a better path to take that will interloop you from avoiding areas of warehouse areas that you can receive fumes on. You can change your AC within your car to make it inside your car instead of those flowing outside to in. If needed, wear a mask to protect your air passageways, as it may be a joke and funny. That's all you have to do now. So like right now you're protecting yourself from your own community because you have to protect yourself from humanity. And consider an air purifier for your home. That could help clean the air that you inhale so that it can clean your system. And here are my references. Thank you so much for listening, Miss Stauber, and thank you for a great semester. I really hope COVID-19 can go away because I really did miss your class and I loved it there. And I hope I made a better presentation. But every time you had alpha sounds, it was in correlation to something else that I had going on. But thank you very much for the experience, you all, even my classmates, if listening. Have a great day and year.